far and away, the biggest threat now is the autism epidemic. Far and away. It really is existential. On April 17th, 2025, the CDC dropped a bombshell on the medical community. This was stunning. The CDC runs 16 autism research centers in a network, and they really screen the kids. They know really who has autism. 2/3 of them have special needs. I mean, this is not a light diagnosis. This is stunning. We've gone from when I was a kid, autism was 1 in 10,000. Now it's 1 in 31. That means it's 3.2% of the childhood population. And that was in 2022. I can't imagine what it is in 2025. Some states like California, it's 5% of kids. Now listen to this. Of the kids with autism, 27% have profound autism. So we're talking, nearly 1% of the population now with profound autism, and defined as a IQ less than 50, unable to speak or understand with any, alacrity, and 24/7 care needs and inability to shower and toilet independently. It's existential, and it's growing at an exponential rate. So this is our biggest threat, autism by far. And there's a penumbra of neuropsychiatric illnesses, including attention deficit hyperactivity disorder, tics, seizures, and some motor disorders. So it's not just autism and profound autism; it's catastrophic.
That sounds catastrophic. What is there anything you and your organization are kind of doing to prepare for that battle?
Yeah, we are. McCullough Foundation is all over it. I just gave the keynote address at the National Autism Summit in San Diego, and I presented a lecture called The Determinants of Autism, and we're proposing that we adopt a risk factor model where we go through the risk, and this is important to your audience. So risk factors are parents at an older age, women over 35, men over 40. Okay, that's more of a contemporary secular trend. Another is babies born prematurely before 37 weeks of gestation, and there's more and more preemie babies and NICU babies. And in one analysis, I cited a baby in the neonatal ICU, about a 20% chance they'll end up with autism. It's pretty high. And then there are clearly febrile seizures of any cause. So strep throat, flu, or if a child gets a very severe fever as a child and has a seizure, about 4% of kids have a seizure during childhood. In a paper by Nielsen and colleagues, very important paper from Sweden, there's about a 40% chance they convert to autism. So these febrile seizures must be avoided. The parents need to be well trained in using acetaminophen, ibuprofen, tepid baths. We cannot let the kids fry their brain with this febrile seizure. And then the biggest modifiable risk factor is combination vaccines. And our CDC has published that in a paper by Duffy and colleagues, the combination vaccines cause febrile seizures. That's clear. That we have analyses by DeLong and others clearly implicating combination vaccines. So it's probably no single vaccine and no single additive in vaccines, but it's the package of getting blasted with a whole bunch early at age. So one paper to quote, this is going to come up, by the way, in Robert F. Kennedy's analysis. Kennedy has promised an answer in September of this year, 2025. But a paper quotable by Mawson and colleagues from the Florida Medicaid system. 49,000 Medicaid children in Florida, data cut at age 9. Okay. And so as a proxy for vaccination, they have the number of Medicaid visits they've had for vaccination. So they have about 10% of that group, no Medicaid visits for vaccination. So they're called unvaccinated. They may have slipped in a vaccine with school programs or church, but by and large, proxy for unvaccinated. And then those from kind of 1 to 10 vaccine visits. The answer here is that the unvaccinated group had a rate of autism at 1.1%, and the vaccinated, it was 2.9%, but it was much higher for those who had, 5, 10 visits for shots. It was even more. So that's just one analysis of dozens. that lead us to conclude a healthy child today, it's safer to wait on these vaccines. And that was the guidance put out by the World Council for Health in 2023. And that's a UK physician-led, evidence-based, consensus-driven organization. They said, you know what? Let's put a weight on these vaccines. No need for kids to get them early in life.
Right. Yeah. Sounds, hopefully, things do change. More truth comes out as the administration. I know people want this administration to, act at lightning speed. And I think they've done a pretty good job of going as fast as they possibly can. But, I keep telling people, give it some time, the more truth will come out as this administration moves forward, which brings me to my final question before we get to a few action items here is what do you think RFK Jr. will accomplish in getting, real science connected to the narratives out there?
I'm starting to understand the methods to his madness. So basically, some have said, listen, this COVID vaccine debacle is just too much for the average person who took these shots. It's just too much to even contemplate. Can you imagine a doctor who completely believed in these vaccines? They took the shots themselves. They had their family members and the children take the shots. They had their patients take the shots. Can you imagine them trying to digest that the vaccines increased myocarditis, blood clots, stroke, immune problems, maybe related to cancer, all-cause mortality? Can you imagine the harm that they caused? I mean, doctors, it's going to be a long time before they, I think, come around and admit, wow, we were wrong. And on big issues where doctors are wrong, they don't admit it for like 20 to 40 years. It takes that long. Okay.
Yeah. Cigarettes come to mind.
Cigarettes, hand washing are the examples, right? The doctors weren't quick on any of that. So Robert F. Kennedy, I think, is doing incremental, Trump incremental. So you saw them drop the vaccine mandates for the military, try to restore the military. We had reports coming in from the House Select Committee from Brad Wenstrup, the COVID Select Committee, Kathy McMorris Rogers from Washington Department of Energy Committee on the pandemic response, concluding our government committed fraud. For sure, they misled the country on masking, lockdown, social distancing, suppression of early treatment, and vaccines. They misled the country on the origins of SARS-CoV-2. And even the White House last week came out with it. It was a U.S.-Chinese collaboration, and it came out of a Chinese biosecurity lab. It got us all sick. But the truth on the vaccines is still going to be forthcoming. And I wonder if it's going to happen during this administration. Trump's been eerily silent on the vaccines. All other major heads of state have been silent on it. They're not out there promoting them, but they're silent.
For sure. Well, yeah, for all of Trump's great qualities, admitting when he's wrong is typically not at the top of his list. Love the guy, but he did push the vaccine himself. Now.